line is Dr. Jane Townson, CEO of the UK Care Association. Dr. Townson, thank you so much for joining us. Good morning.
Good morning.
So the Prime Minister says keep calm and carry on as normal. Is that possible in your industry?
Well, we have in home care nearly 700,000 home care workers going out every day, normally from 7 in the morning till 10, 11 at night. They're supporting older and disabled people in their own homes. And many of them have been struggling since last Friday to access fuel, and particularly in the rural areas. If your local petrol station hasn't got any fuel, you might have to drive 15 miles to the next one. And it's not at all unusual for home care workers, particularly in rural areas, to drive 100 miles on one shift. So the tank, becomes empty quite easily. And it's just very stressful because the older and disabled people they're supporting are completely dependent on them. Many can't get out of bed on their own, eat by themselves, drink, go to the bathroom, and some are on pain-relieving medication at end of life. Others need peg feeds, they need tubes through their stomach for food. Some of them need catheter care. And, the care workers know the impact on people if they can't arrive on time. They've been, like everyone else, stuck in traffic jams. So sometimes they've been 2 hours late. And they're struggling to figure out in some branches, how to share out the cars that have got fuel in between them and make sure that critical calls are covered.
I mean, we did hear from somebody who said they just could not get to their first port of call till they were about 45 minutes late. That meant the person who was unable to get out of bed, completely bedridden, just waiting 45 minutes more, which obviously jars their whole day and is very difficult for them. And the knock-on effect is enormous as the day rolls on.
That's right, yes. And our point is that there should have been contingency plans in place last Friday. Unfortunately, local resilience forums who normally have the contingency plans aren't able to invoke them because government won't declare that there is an issue. So the message has been back to home care providers, just use your own business continuity plans. But what are you supposed to do?
Yes.
When they didn't have any PPE, they were able to make their own masks and turn bin bags into aprons. But now, how do they procure fuel? Are they expected to go and advertise for drivers? And it's just nonsense, isn't it? And some very simple solutions could have been put in place to, for example, make a pump available for key workers, and that's not just home care workers, all kinds of essential workers. And at a given time, and give vouchers so that the petrol station staff know who's eligible and who isn't. And of course, many home care workers, just like the builders that you spoke to earlier, are on 0-hour contracts. So if they don't work, they don't get paid. So this, if it went on for too long, could have a negative impact on their income and well-being as well.
Yes. And the idea of the Prime Minister saying it has stabilised, is that what you have been fed back by your members? Have they told you that it is stabilised and they're feeling a lot more confident today, or have you not heard that?
I think it's very patchy. Some people have managed to fill up, others are still scrabbling. And, there doesn't seem to be any regional pattern to it in particular. Obviously, it's encouraging that the fuel companies say it's getting better. So, it will pass eventually, won't it? But, it just feels as though there's a complete lack of concern about the health and well-being of older and disabled people, living at home, and key workers trying to go about their jobs. I think I saw a head teacher interviewed on television yesterday who was on the point of having to close school for certain year groups because staff couldn't get there.
I appreciate you joining us this morning. You must be very, very busy and also very concerned about everything going on. So thank you, Dr. Jane Townson, CEO of the UK Care Association. We're taking your call.